Through the COVID-19 pandemic, we've been welcoming medical professionals to answer your questions about the coronavirus. All you have to do to ask a question is text the number on your screen, 479-785-5055. This afternoon, we're joined by Dr. Sonal Bhakta. She is the Vice President of Medical Affairs for Mercy Hospital. Dr. Bhakta, thanks for being with us today.
Hey.
All right, let's begin with telling us about yourself and your role at Mercy Hospital.
Sure. As you mentioned, I am currently the Vice President of Medical Affairs. I'm a board-certified internal medicine physician. I've been a hospitalist here for the past 10 years. In my position, I work with a team of professionals to direct our operations in the hospital, and right now our main focus is COVID-19. I work directly with our physicians who are working to prepare for and treat patients who are diagnosed with COVID-19. Everyone is working extremely hard, and our objectives are currently to serve our community, protect and sustain our caregivers, effectively treat all of our patients, including those diagnosed with COVID-19, and to inform our community about how to prevent the spread of COVID-19.
What are some of the things that Mercy hospitals are doing to keep patients safe, and why is that so important right now?
Sure. We're constantly developing and evaluating our processes. We're creating processes daily. We're evaluating those processes daily. Our team is working diligently to ensure that our hospital is a safe place to work and a safe place for our patients. Currently, we've implemented visitor restrictions. We've expanded those visitor restrictions as of tomorrow. We know that this is an inconvenience, but we have had great cooperation and we appreciate the community's understanding. It's critical that we reduce the number of people coming in and out of the hospital to limit and decrease the exposure to a minimum.
Are there some exceptions for visitors who are allowed inside the hospital during these restrictions?
Yes. Starting tomorrow morning, the exceptions will be mothers who are giving birth, children in the hospital, babies in our neonatal intensive care unit, and for patients in the end of life. Again, we know it's an inconvenience and we appreciate your understanding and cooperation, but these are unprecedented times and we must respond.
Does Mercy Hospital have any confirmed cases of COVID-19, and how are you treating those patients?
In the hospital space, we do not have any confirmed cases. We have several suspected. We do have an established unit in the hospital to separate and treat the COVID-19 patients. We've designated a small number of medical coworkers to treat those patients, including the frontline staff from physicians to nurses to coworkers, again, to limit the exposure. We can't say enough about these coworkers' dedication and sacrifice. We're just working really hard.
Can you talk a little bit more about how any potential patients in the future will be kept apart from others in the hospital?
Sure. As I kind of mentioned, it will be in that our dedicated unit that we have for COVID-19 patients. Any suspected or confirmed cases will be kept separate in a designated area.
I know that Mercy set up an evaluation site last week for people that are presenting with symptoms of COVID-19. How's that been going so far?
Sure, it's been received very well by the community. The word is out, and the patients must call to be screened by a triage nurse over the phone. Anyone with concerns about having symptoms related to coronavirus should be evaluated. Symptoms include fever, dry cough, respiratory issues, especially difficulty breathing. The number is 479-717-7585. It's a drive-through testing site. That's a convenience for patients who aren't feeling well and meant to limit the contact with coworkers and other patients in our hospital and clinics. As of Sunday, we had swabbed more than 75 patients after opening the site on Friday. The results do take several days to come back, so please be patient with us as we are working with our laboratories to try to expedite the results, but they are taking several days to come back. And anyone who is having difficulty breathing should go ahead and seek emergent medical attention at the ER.
If you're looking for that phone number, you can find it over on our website as well, 5newsonline.com. And again, just to clarify, people are not supposed to show up at this site without being told to go there, correct?
That's correct. They need to call that number first and be screened as appropriate for testing.
We've heard of a lot of people who are making homemade face masks to donate or distribute to hospitals. Is this something that hospitals can use? If not, who can use these?
Well, I'd like to address that, some of our wonderful and very well-meaning community members are seeking to donate PPE to Mercy. In most cases, the equipment isn't medical grade, personal protective equipment. If we get to a point where we must ask the community for help, we will reach out for the community for their assistance. An example of something that we do have an immediate need for at this time are Tyvek suits, painter suits, and chemical splash safety goggles. If anybody has any of those items, we will gladly accept your donations at this time.
What's the best way that they can get a hold of someone at the hospital to provide those donations? By
calling the operator, 479-338-8000, and
Okay.
then they'll be directed to the correct place.
We have a question from Lisa this afternoon. She's asking, if a person suspects they are ill, should they begin taking antibiotics to potentially avoid the bacterial pneumonia?
So current evidence, of course, this is evolving as we go, as we all know, the disease process. We're learning more every day about coronavirus, but at this time, we do not know of any associated bacterial pneumonia that is correlated to the COVID-19 virus. If you do suspect any kind of bacterial pneumonia, it is important that you call your primary care doctor and seek medical advice in that way.
All right, great advice. Thank you so much for answering those questions. We'll have more of your questions for Dr. Bhakta coming up here in just a few moments after this commercial break. All right, Garrett, thanks. We are joined again this afternoon by Dr. Sonal Bhakta, the Vice President of Medical Affairs with Mercy Hospital. Thank you for being with us. We want to get to a number of viewer questions just sent in to us. The first is, if a patient who thinks they have symptoms does not have a primary care provider, what should they do in this case?
Well, we do have a way to get a primary care doctor through our Mercy website on mercy.net. I would encourage you to use that. Otherwise, if you do think, again, if you feel like you have symptoms, you really need to call that phone number that I gave earlier, the 479-717-7585, and we will get you screened and tested appropriately.
And you can do that whether you have a PCP or not, correct?
That's correct.
Okay. Can you tell us a little bit more about how COVID-19 is impacting younger people? We had heard for the longest time that it seemed like those who were younger and in good health were coming out with fairly mild symptoms. Is that still the case?
For the most part, yes. There are cases where it does affect younger people severely, but for the most part, what we do know and the trends that we do see, usually it's a mild infection or they're asymptomatic in the younger.
Peggy is asking the question this afternoon: can COVID-19 be transmitted through the mail?
Well, per the reputable journals, we know that the virus lives on adamant objects for a variable amount of time. I have no reason to really believe that paper or mail would be any different. So in that instance, I would recommend just using proper hygiene after handling, just as you would with money. Wash your hands diligently after you handle mail.
And is that the same then for packages that come in the mail as well, with cardboard or plastic surfaces?
That's correct.
So what can be done for folks that are at home and they're self-isolating, they're social distancing, but they're at home with their family? What can you do to stop the spread among family members?
Well, I would use common sense. I would practice good hand hygiene. Again, wash your hands with soap and water many times a day. If you can, within your own home, practice social distancing. Try to stay 6 feet away from other family members if people are having symptoms, definitely.
How do you recommend doing that for those of us like myself who have young children, especially toddlers or infants? How do you do that?
That's a good question. I have 2 small children myself, and I'm not sure that I would be able to do that at that time. But in my personal, I've thought through it for my own self, and if I were to have some sort of known exposure, I would just have to self-quarantine at that point.
And by that point, you mean even in a separate room of the house, if you can?
That's correct.
Gotcha.
That's correct. Where I would have minimal interaction, if maybe no interaction with my children.
Okay. Let's talk about the peak of the coronavirus in Arkansas. What are the projections like, and what can we see in the future as this continues?
Well, the projections per the governor are that we'll see a peak in 6 to 8 weeks. I think the projections that I've seen, the different models that I've seen, are based on the type of things that people are doing. If we social distance effectively, the peak will be, the duration, I guess, will be different compared to if we don't do nothing. And also the models that I've seen in terms of taking in-home shelter, you can see where the projections show that the duration of this disease will actually be much shorter if we actually put those into place.
And why is that so important, especially where we are on the trajectory so far?
We have to flatten the curve. We have to flatten it. That's the only way. We have to quit being around each other. It takes 5 to 7 days for most people to start seeing symptoms. You could be infected, you could be exposed, and you wouldn't even know it until well into the course of 5 to 7 days after you've had it. And so by that time, you've had plenty of opportunity to be around others and infect others. So.
Well, thank you so much for answering those questions. We'll give you the final word when we come back after the break.